Hi, this is the fifth in a series of discussions I'd like to have about death, dying, and end-of-life care. And in this one, I'd like to discuss hospice care and palliative care. Now, hospice care is generally deemed to be end-of-life care when a person's life expectancy is 6 months or less, and there's no longer any hope of a cure. So you're not trying to cure the person anymore. You're just trying to make them as comfortable as possible. And it's hospice care can be done in a home or a hospital, in a freestanding hospice building, or in a skilled nursing facility. And it's usually a team approach, and it involves not only relief of pain and suffering. They have all kinds of wonderful tricks. Um, um, so relief of pain and suffering, but also emotional and psychological care. And what I found, who finds this very valuable, is the families. It's sometimes it's really difficult to make that transition from you've been fighting the cancer for so long, and then all of a sudden the patients decided they're ready to accept that death is going to happen, and it's hard for family members and sometimes even the patient to make that transition emotionally. And hospice nurses and staff are really, really good at helping people cope with the imminent death, and they make sure that the patient has everything that they need to be as comfortable as possible. If they have a wet cough, they'll give them medicines to dry up the cough. Pain medicines through pain pumps, and it's a really humane way of spending your last few months. And generally, it is covered by Medicare. Most insurance companies will cover it, and Medicaid apparently in, I think it's 43 states, will cover it. Now, you can get a referral from your physician, and a lot of physicians also have trouble with this transition from curing to letting go. And so I would suggest that you ask for hospice care. They may not tell you. A lot of times what happens is they wait until it's a few weeks or days before they involve hospice. And really the benefit can be had for 6 months. You can really benefit from a longer hospice. And you can also get information about hospice from the hospital discharge coordinator. You can get information from the Yellow Pages, and online you can go to, let's see, American Cancer Society online, or your state's hospice organization. So again, that is primarily for end-of-life care, when you are no longer attempting to fix a problem, but you just want to make the person and the family as comfortable and as ready, and make it as easy of a death experience as possible. And palliative care, on the other hand, can be had at any stage in a chronic illness. And the chronic illnesses have a wide range. It can be MS, it can be AIDS, it can be ALS, it can be heart failure, kidney failure, liver failure, cancer, just a whole raft of conditions, COPD, lung disorders, where a person just needs a team effort to keep them as comfortable as possible while they can still be receiving attempted curative efforts. Now, palliative care, as I say, it's a team approach also. So there's doctors, nurses, there's spiritual care, emotional care, and care also for the family and the caretakers, because for a long-term illness, the caretakers can need help too. And this is also covered by Medicare, many private insurances, and Medicaid in some states. And so what I found is not all hospitals are equipped they don't all have palliative care teams. And so one way to find out was I Googled an organization, and I just Googled the words "get palliative care." And they have a list, a provider directory list state by state. And it had a list of states and cities and the providers of palliative care teams in those cities. And I also feel that that is an up-and-coming thing. Just as I was leaving work, my hospital had organized a palliative care team, and I think it's an excellent approach for individuals with long-term illnesses that require a coordinated team effort. And so that's another thing that you can consider. And you can still have, with palliative care, you can still have curative care. So that's enough for now. I hope you have a thoughtful day. Bye.